we go. I'm having
All right.
some
You
light
good?
issues.
All
Yeah,
right.
now I'm good. Yeah.
And we are live. Welcome, welcome. This is Dr. Sarah Merritt at Lifestream Health Center in Bowie, Maryland, here with a very special guest, Dr. Funke. She is also known as Restful Sleep MD. So just to reintroduce myself, I'm Sarah Merritt at Lifestream Health Center in Bowie, Maryland, where we're striving to make pain management caring and accessible, patient-centric, and evidence-based. If you're looking for a pain doctor in Central Maryland, this is the place. Come see us at Lifestream Health. You can find us on our website, lifestreamhealth.com. And we want to bring you resources, things to help you live better with chronic pain. One of my colleagues here is Dr. Funke, who is an expert on sleep medicine. And in fact, she's such an expert, she was featured recently on ABC News. Is that right?
Yeah, yeah.
That's exciting. Well, Funke, tell us a little bit about your practice and how you came to do what you do.
Yeah, absolutely. Thank you so much for having me. So, like you mentioned, I founded Restful Sleep MD, a few years ago, and really my mission is to help professionals, especially women and their children, to prioritize sleep and sleep better. Really, so my mission is about promoting sleep health and helping people figure out how they can get good quality and good quantity sleep. But on the backbone of that, I am a sleep physician. I'm also a pediatric pulmonologist. And so, really doing this has been very exciting and really fulfilling for me.
That's awesome. So, how did you get interested in sleep medicine?
I know that's a good question, right? So, it was personal. It was a bit personal, and then also in the strive to improve my patient's health, honestly. So,
Mhm.
I finished my pediatrics training and then went on to do a fellowship in pediatric pulmonology.
Mhm.
And of course, through that whole time, one thread or two pieces of thread just laced through my entire career up to down, and that was
Yeah.
insomnia and sleep deprivation. Right? It
Oh my
was
gosh.
just, it was a thing or not a thing. Sleep, right?
Mhm.
So, and there's some people that are a bit more sensitive to sleep deprivation than others. I guess I was more on that end. And so that in and of itself just created an awareness of how sleep was impacting just my function. And
Mhm.
then by the time I was seeing my patients, how, they have reflux, they have asthma, they have anything, and they're not sleeping well, and their parents are not sleeping well. And so I really wanted to get a better understanding so I could help them. And then, now I'm really focusing most of my practice on sleep, even
Mhm.
though I have all these other certifications. And so and then I landed here because I wanted to not just help the kids, I wanted to help the moms as well. And so this my program has helped me achieve that. So that's really been exciting.
That's great. Yeah, I think I talk to so many patients that have challenges with sleep,
Mm,
right? I mean, and that's how I interface with people with pain problems or sleep
mm,
problems.
yeah.
So yeah, it's just very common for me to hear that. Um, it's very common for patients to tell me they have trouble falling asleep or
Mhm.
staying asleep. How do you approach that or even start to talk about that with patients? I mean, I think sometimes when I speak to a patient, they may be looking for, a quick, you know,
Mm,
solution, and they may feel like they've tried a lot of things. So,
mm,
for me, like that's one of the challenges as a clinician is to legitimately, dive into what are your challenges and find
mm.
some productive solutions.
Yeah, no, absolutely. So, they're under the category of insomnia, right? Which is
Mhm,
difficulty falling asleep, staying asleep, and waking up early with
mhm,
daytime consequences. Either you're just dissatisfied with your sleep or not. You have quite a number of categories under that. So you might have insomnia that's, what we call psychophysiologic insomnia, meaning that you just have that increased cognitive arousal. And
okay.
then many things that can trigger that, like if you have anxiety, if you've had a chronic illness and you struggled with sleep in the past, then,
Yes.
that's only going to make it worse. And then we have insomnia that's related to other underlying issues or disorders. But one thing is clear, there is sort of a what we call a predisposing factor. So usually tendencies towards having insomnia. It's part of our we call it the 3P model of insomnia. I'll talk about the 3Ps now.
Hmm.
So there is what you call the sort of the predisposing factors. So that may be someone who already is sort of a little bit high wired, like, a little bit anxious, maybe a little bit of type A,
Hmm.
maybe some genetic factors or things like that, right? So that's the predisposing factors. And then we talk about the precipitating factors. So, you're already kind of steadily coasting along, sort of doing okay with your sleep, and then you now have something happen, pain,
Okay.
right? Something triggers it. So either pain, surgery, an illness, loss of a loved one, stress, a move, anything, right? And so that now creates this cascade where you initially may have had a little bit of trouble with sleeping, then it now becomes habitual. You
Hmm.
suddenly start to feel stressed because you're dreading bedtime. You suddenly get into bed and your mind is racing and you're tossing and turning and tossing and turning. And then the third P is what we call the perpetuating factors. And what does that
Hmm.
mean is just the things and habits that we now get into that now make this insomnia sort of chronic, right? So that's where you may see people say, you know what, I didn't sleep well, so I'm going to just lay in bed all day trying to get more sleep, but it ends up making your sleep worse. Or I couldn't sleep, so I had caffeine in the morning or caffeine in the afternoon because I was trying to stay awake during the day. And now there's caffeine in my system and I can't sleep at night. And so I'm going to take some alcohol to try to take that away. So all of a sudden, we're in this vicious cycle. And now you throw in other things, right? External things. Well, maybe not external, both external and internal. You throw in pain, like you mentioned. You
Right.
throw in environmental factors. Maybe you live in a noisy neighborhood. You throw in menopause, or temperature of the house is hot. So all that just creates this mishmash of awful sleep. So I hear you when you say you're trying to like tease out what is pain, what
Hmm.
is just this cycle of poor sleep, because we're now in this kind of habit loop, and
Right.
sometimes it takes really demystifying it.
Yeah. Yeah. Because I think very often, if I'm speaking with a patient who has pain
Mhm.
but who also has problems sleeping,
Yeah,
they do sense that, hey, I would feel better if I could
yeah,
sleep, whether
yeah,
whatever it is that helps me sleep better,
yeah,
whether it's a medication, a pain
yeah,
medication, something else entirely.
yeah.
And in my experience, I do see that patients are very open to a lot of different
Mm,
interventions that may help with sleep. Although I will say, like sometimes, some of the ones like just setting your habits
mm,
can be the toughest ones.
yeah,
That's like a simple thing,
yeah.
simple but not easy, right?
Yeah, absolutely. And you know what you said, it's almost like sometimes it's almost like a two-way traffic, right? Like what is driving the poor sleep? Is it pain? Because if you're
Hmm.
uncomfortable, right? We've all had days where maybe you had an injury and of course your sleep is crappy, right?
Hmm.
But the problem is if you do have poor sleep, then your pain threshold is kind of lower, right? So you are more likely to feel the effects of poor pain. So I think addressing both is helpful. And like you said, of course, we want a quick fix because you already had bad sleep.
Yes,
Now you're
you're
talking
ready for
about
this problem to be solved. Yeah,
habits and
yeah, no.
rituals at bedtime. No, I want to just get into bed and crash. So it is a hard thing. And
Hmm.
sometimes you do need medication, at least sometimes to, take the edge off so
Okay.
that they can get to that place of, okay, things are a little bit at bay. I can now start to address some of the behaviors and the habits and things like that. And honestly, I think that's why it's so individualized because everybody is different.
Yeah. What are there medications in particular that you have found helpful for your patients who are looking to sleep better?
Yeah, I mean, I honestly, one of my mantras or one of the things I tell clients that I work with is my goal is to make sure that you're able to get restful sleep without meds.
Yes, that's where we're
But
headed.
I know exactly.
Yeah,
But, is there a need for, a bridge, something to get
yeah,
you over the edge? Sometimes depending on who and where they've been, sometimes starting with just melatonin in and of itself is
yeah.
is fine.
Hmm.
Depending on the cause, sometimes if I have patients who and we're working on this, we're also trying to find out, is there anything else that could be contributing to your sleep? For
Hmm.
instance, I may have a patient who has restless leg syndrome, right? So they have the discomfort in their legs where their legs seem to have a life of its own
Mm-hmm.
in the evening, and it's causing all this discomfort and abnormal sensations in the
Yes.
evening. In that case, I may want to check an iron level first to see, are your iron stores low? And then I'm treating them with iron supplementation,
Mm-hmm.
right? Sometimes I may put them on supplements like magnesium, because that's also been shown to kind of help relieve cramps and discomfort and
Mm-hmm.
things like that.
Mm-hmm.
Sometimes, depending again, if they're having a lot of discomfort around either legs and things, I may do gabapentin, which is a
Mm-hmm.
medicine that we use for pain. Of course, you know that.
Mm-hmm.
Um, and then we may, in some occasion, then start to talk about the non-benzos, kind of like the Ambien and things like that, and the trazodone. Again, my preference is very, very short term,
Yeah.
because I think one of the things we've seen with some of those medications is, the side effects, depending on the age of the person. There's increased risk of falls, there's daytime tiredness and
Mm-hmm.
grogginess. But if we're looking for, okay, I am stuck in a bind and I just need something to bridge me over, those are some things that can help. Of course, if they have, again, a lot of patients, especially for those that maybe they have pain and things like that, they may also have underlying mood issues, right? Maybe depression or anxiety. And in those situations, I'm working really closely with their psychiatrist to see if there's things that we can use that can help with mood, but maybe could be a little bit sedating.
Very good.
That's kind of the way we work our way sort of down.
Yeah. Yeah.
Yeah.
And here's a related question. I have a lot of patients that ask me about medicinal cannabis for help with sleep, or, oh, doc, I've been taking this THC gummy. We do have, medicinal cannabis is legal in Maryland. And so that's a hot topic that people will sometimes ask about. What's been your experience with that? Or do you have patients that have had any success with that medication?
Not on the long term. I
Hmm.
think one of the things that I've seen with that, sometimes it can help with, anxiety. And
Yes.
of course, if you have anxiety and you're not able to sleep, then if you take care of that anxiety, then that may help sleep. There's
Yes.
really no studies that are showing that it helps directly with sleep. And in fact, there's some studies that are showing that it actually makes your sleep more choppy.
Mm-hmm. Hmm.
It can actually make sleep worse. So even
Yeah.
though so it's like how would we say it? Like you're robbing Peter to pay Paul.
Yeah.
So
Well,
you're
and alcohol, I think, has similar data, right? That alcohol
exactly.
is associated with quicker sleep onset, but poor sleep
Sleep
quality.
quality, exactly. And we're seeing more and more of that evidence now, where they're actually looking at sleep studies on
Yeah.
patients who are on, so I think, yes, again, it comes back to what are we trying to address? If it's anxiety that's driving it, then looking for strategies. Cognitive behavioral therapy is actually the gold standard
Hmm.
for insomnia, and even for people that have chronic pain, underlying medical disorders, and things
Yes.
like that, including it as sort of the packet is very helpful. And yes, it's hard. Sometimes it's hard to get access to a specialist that's certified to do CBTI, which is what we call it. But now
Hmm.
there are resources, there are books, there are apps, there are things that people can use that can actually
Yeah.
help, which may end up helping them get off the medication and things like that on the long term.
Yeah, I'm interested. Are there particular apps or tools that
Yes.
you have recommended and had success with in your population?
Yes. So one is CBTI Coach. That's
Okay.
actually pretty good. And it's been used in research and it's been, really, really very effective.
Hmm.
And it helps with tracking. You kind of clock in your sleep. You talk about, you put some numbers in and then it tailors recommendations specific for you.
Hmm.
Another thing that I know helps a lot of people, again, around insomnia is that mind racing and they can't shut their mind down and they're perseverating and
Yes.
really thinking the worst case scenario would happen the next day. I'm never going to be able to get out of bed because I'll be so tired. I'm going to make mistakes and things. So implementing relaxation strategies is very helpful too.
Yeah.
So that's where, again, mindfulness apps come in. I think I'm going to come up with my own mindfulness and CBTI apps now because I'm promoting
I
all these. And
I think you should. I think you should. Yeah,
you know,
absolutely.
so mindfulness apps are very helpful. Breathing
Mhm,
techniques are good.
mhm.
Listening to something that's calming and pleasant.
Yeah,
Those things can actually help with relaxation and getting you to the present instead of, skyrocketing into, thoughts that will not serve
yeah.
you.
Oh, that's so good. I like that about it. It will help getting you into the present because, yeah,
Mhm.
I think I would share that I've had trouble falling asleep in the past, and
Or-
it's been honestly, it's been years. I don't
Yeah.
struggle with that currently. Probably few doctors do, maybe after residency. I don't know.
Yeah.
Some
Yeah.
there's some
Traumatized.
and traumatized. Yeah,
It's like you're waiting for the pager to go off.
right, right. But there's no end to stuff you could worry about, right? So if you
No.
decide you're going to worry about things, there's
Yeah.
and I could think of an endless stream of things to worry
Yeah.
about. And at some point, you have to,
Yeah.
you know, here's
Mhm.
what I'm going to focus on, and it's now, and it's the things I
Mhm.
can control, and um,
Mhm.
making that decision and coming to that in your own way, right?
Yeah.
Like I can say that for myself, but how helpful is that for anybody else, right? The
Yeah.
the patient, I think, really
Yeah.
has to get there themselves to where they
Yeah.
can um, pilot their own brain in that direction.
Absolutely. I think I would add too while you get there, because that's actually what you just described. It's actually a very, very fundamental part of cognitive behavioral therapy that we
Mhm.
use for insomnia, where you are looking at those maladaptive, those abnormal, those thoughts that are not serving you, right? In
Yeah,
the moment, right? They're not
yeah,
serving you, they're probably not true, all
yeah.
that stuff. But it takes time to get there. But we also have sort of more, again, behavior strategies that we can put in place that can help you. So
Mhm,
having a bedtime routine is one of them, right? Not just
mhm.
going into bed without really winding down from your day. It plays a huge role in kind of just dissociating or kind of breaking that connection between the fast pace of the day
Yeah.
and the night. And then also things like what we actually call it stimulus control. It's
Okay.
just a fancy term for your mind is racing at bedtime, right? You can't quiet your mind. You're in bed, and then your bed becomes a place where you worry. So we break that association between bed and worry. And the way we break it is we say, don't go to bed if you're
Mm,
not sleepy. And if you're in bed and your mind is running a mile a minute, get out of bed
wow. Mhm.
and do something else relaxing and then get back into bed. Like those don't necessarily need you sort of trying to capture or harness your thoughts, which you should. But
Yes,
then these are like at least some like practical things that you can do to get you started.
that's great. Yeah, I think that's a huge insight because
Mhm.
I think that has to be such a difference maker if you
Mhm.
catch yourself in those moments to
Yeah.
uh, find a way to
Mhm.
modify what you're doing so you can get that different outcome.
Yeah. Yep.
Yeah,
Mhm.
that's great. That's great. Um, what do you think about the amount of time that people spend in bed? I feel like I heard lately that before the advent of electricity and indoor light bulbs, that Americans were sleeping 9 hours a night, and I thought that was like unthinkable. Like, is that for real? Um,
Yeah, it's not necessarily changed the number of hours we need. It's 7 to 9 hours, but yes, you're right. That with light
yeah,
and technology and the pace of things, like it's like we're trying
yes,
to cram so much into the
we're
day. So
constantly connected. Yeah, no
yeah,
doubt.
so I think that's playing a big role. Time in bed. So there's something we look into. It's called sleep efficiency. It's so
Okay.
practical. I think that's the thing I love about sleep medicine. We just make it very simple because people are
Mhm.
already tired. So we don't want to make things complex for you, right?
Yeah.
So we want your sleep to be efficient. So how do we get sleep efficiency? We want it such that the time you spend in bed
Hmm.
and the time you are spending asleep are pretty much close together.
Yes.
So when you're in bed, you shouldn't be on your phone. You shouldn't be really reading, watching TV, eating dinner, worrying, stressing. No, no, no,
Yeah.
no, no. That makes your sleep inefficient because it's a ratio, the time spent asleep over the total time in bed. So
Mhm.
that's actually one of the ways we address insomnia as well. It's called, we call it, some people call it sleep restriction. I call it bedtime restriction. So
Hmm.
you want to minimize the time, especially people that have a lot of pain and discomfort. They want to just lay in bed because that's where they feel a little bit of comfort, right? I just gonna lay in
Yeah.
bed, I feel better. But the problem is the longer you lay in bed, the more your mind starts to associate your bed with all kinds of random things. And so you want to try to maybe have a couch or somewhere you just chill if you're not sleepy. And then when you're
Hmm.
sleepy, you get into bed. So that if you're in bed for 8.5 hours at night, overnight, we want you sleeping maybe 8 hours of that time, or seven, you know what I mean? Like you don't want to be in bed for
Yeah.
too long and then you're sleeping, haphazardly or half the time.
And how do you measure that? I mean, I think one challenge that I see too is a patient
Mm.
will, or even my kid, my 10-year-old will be like, I didn't sleep at all last night. I was awake all night long. Like he has told me this like more than once, and I'm thinking
Yeah.
to myself, you were not awake all night long. You may have woken up.
Yeah.
Um,
And
how do you figure this out?
oh
Do you
yeah.
use sleep monitors?
Absolutely. And I think that's such critical data when I take
Uh-huh.
care of my patients and my clients with insomnia. Like this is the data because they're like, I didn't sleep for the whole week. I was
Yeah.
awake for the entire week, which is physiologically impossible. So that's one of the things we
Hmm.
say. But then I don't want them to feel like we're not here. I hear you. It feels like you're not
Yeah.
sleeping well because your sleep is light.
Your sleep is
But
bad.
exactly. But the way we monitor that, honestly, is I use what you call a sleep diary or a sleep
Okay.
log.
Hmm.
That's actually also part of what we use when we're treating people with insomnia. So what that is literally a record, vague recollection in the morning of when you went to sleep, how long it took you to fall asleep, if you woke
Okay.
up at night, about how long were you awake for, and when you woke up in the morning, and
Okay.
how you felt when you woke up. And so we usually will log this every week and go over it.
Hmm.
And then with that, I can calculate your sleep efficiency. I could see what's the
Hmm.
ratio, and we start to work on that ratio to get it to a good number. There are so many other ways to track it.
Sure.
I like using the pen and paper, or a sort of like a
Yeah.
Google document,
Yeah.
because it gives my patients with insomnia who are already worrying, it gives them something to do
Yeah.
and take their
Yeah.
mind off. So it's a good
Yeah.
habit.
Yeah, it's
Otherwise,
more
we use it
active versus passive, like, "Oh, what does the watch
exactly,
say?" "Oh, it
ex-
just says blah, blah, blah," versus what I
exactly,
say.
exactly. And they can journal how they felt, right? And so we
Mhm,
can have a
mhm.
discussion. But yes, you're right. Your watch, your Aura Ring, there's so many sleep
Yeah,
trackers out there. I always recommend, especially for those who have insomnia, meaning that you already have sleep as a struggle,
uh-huh.
to stay away from that as much as possible because it causes a lot of distress. Because then they're like, see, my wife said my
Yeah,
sleep was crappy, and then they feel worse, and then they're constantly monitoring. And there's actually we now have a disorder. We actually an actual diagnosis for that because it's become a problem. Like my tracker, and we're like, wait, how do you feel beyond your tracker? Right.
mhm.
So I think it's always a fine balance.
Yeah, yeah, no, they're very similar in, like, the pain literature, like, this
Mm,
idea of around, like, obsessing on pain scores
yeah,
is, like, actually not that helpful,
yeah,
versus, like, how do you function? How do you
mhm,
feel? What's better? What's worse?
yeah,
More of a narrative, description of people's pain is so much more informative than just some number or obsessing over a
exactly.
number you need to be at.
Mhm, mhm.
Yeah, no, that's so interesting, and I would share accidentally fell asleep with my Apple Watch on recently, and I
Mm,
didn't even know, but it actually can measure
mhm.
REM sleep and
Yeah,
deep sleep. I was amazed, really. I hadn't done that since whatever upgrades happened, and it
yeah.
was pretty interesting to see.
Yeah, yeah. I would say the algorithms they use for measuring deep sleep and REM sleep are still not quite where
Yeah,
they should be compared to a sleep study.
yeah,
But for someone who's just like curious, who's just like, oh, I just want to see what my sleep, I think
yeah.
it's nice. It's helpful to see trends. Like how long
Okay.
does it take me to fall asleep? How long, you know what I mean? Like
Yes.
what's my sleep efficiency? I think it's helpful for that, like to
Hmm.
inform you. But again, if you're someone who has sleep problems, it can quickly become a stressor very easily.
Yes. Yes.
Mhm,
Yeah. I like what you said about the journal. I could see that being yeah, as productive as anything.
mhm, mhm.
Very
Yeah.
good. And I suppose the trackers mostly a tracker that a consumer would have at home is going to be measuring heart rate for the most part if it's on
Yeah.
your body and heart rate, I guess, variability as you're
Mhm.
in different stages of sleep,
Yeah.
etc.
Yeah, it can again because when we've looked at head-to-head studies with a standard like sleep study, which we
Yeah.
use to really assess your sleep, it's still missing it quite a bit, right?
Okay.
But it does give you like the trends, like what's going on. Because one thing is the trackers, unlike a real sleep study, if you lie very still, and especially with people who have insomnia, where
Okay.
they're just trying to force themselves to sleep and they're just laying really still, the trackers many times will think that you're breathing shallow, you're calm. The tracker
Mhm.
might misinterpret that for sleep. So
Ah,
when
yeah.
but then if you take that one number once one day and then you run with that, that might not be a true reflection. But if you have a trend, then we might be able
Mhm,
to say, okay, there might be something going on here, let's have a conversation.
mhm. Very good. Yeah, I think that's so interesting. Yeah, there's so much progress. So do you tend to order studies, sleep studies for your patients, or I guess maybe it depends on what the need or what the issues are. It sounds like not everybody needs a sleep study if they're having
No,
sleep disturbances.
not at all. That's a really great question.
Hmm.
So first, in my coaching program, really what we're doing is more habits, behaviors, routines. But in my medical practice,
Hmm.
um, we are getting sleep studies if we have concern that you have either sleep apnea, where you have pauses in your breathing during sleep, and
Okay.
that's, I mean, it's definitely something we're looking out for, especially when someone says they have snoring and they have restless sleep and they're waking up very tired and they're sleepy during the day. So those things, or if you have someone who's overweight and things like that, we there's a higher risk of sleep apnea. We're getting that.
Hmm.
If I'm concerned, you have, things like we call it periodic limb movement. So it's kind of like the sleep study version of a restless leg syndrome where you're kicking in your sleep, but you're not aware. And all we're hearing is, I'm exhausted. And my partner says the bed looks like, I don't know, a tornado went through it in the morning. So we might get the sleep study for that. If we have concerns about things like, you know, maybe what else now? Maybe narcolepsy or something. Then same thing. We're getting that. So those are kind of the more reason. But if you have insomnia where you're not sleeping, then a sleep study wouldn't help.
Would or would not?
Would not help.
Would not help. Yeah. So if you
Mhm.
have a insomnia, sleep study is not needed. Okay.
Yeah.
Very good. Very good. Um, Tell us more about your coaching program. So who is it that you're looking for? What kind of people would benefit from working with you in your coaching program?
Yeah. Absolutely. So with my coaching program, it's a one-on-one coaching program.
Okay.
Really, the people I work with are high achieving women who either have difficulties with managing time to get sleep,
Hmm.
or they're in bed, or they have the opportunity to sleep, but it just feels like sleep eludes them. So either they have racing minds, they have kids that are not letting them sleep, or they have any other issue. So we delve into why they're not sleeping, and then we try to address it from that standpoint. And we do 7 sessions, weekly sessions, where we're talking about this again, delving into a lot of the details I talked to you about, going and setting goals really to get them sleeping well again.
Yes. And are you able to help your coaching clients reach those goals? What are your results like?
Absolutely. So I've had quite a number of mixed. I think that's why what I love about it. It's individualized, right? So I've had parents who come in and say, my child doesn't sleep at all,
Mm.
doesn't sleep, right? And so because of that, I'm exhausted. So they become trained to coach their own children to sleep. And of course, when the child is sleeping, all of a sudden their lives are completely different. And
Yeah.
then we have, I have women who have boundary setting issues, right? They are overwhelmed because they're doing so many things for so many people. And so we're able to create boundaries. We're able to address what's, again, the mind racing piece. We're able to develop strategies around cognitive behavioral therapy as well to help them to get sleep better. And there are people who are on medications and they're like, I know I don't want these medications. And so we're able to work
Ah,
with all
help
those
people
to get
stop the
them
medication. Hmm.
off the medication and help them sleep naturally.
Oh, that's great. Yeah,
Yeah.
that's great. Yeah, I think that is a challenge for sure. I've worked with patients in that regard too, and it can be challenging to help people work through those weaning issues, just because it needs to be done usually over some time, and you need to spend some time in consultation to get it done right.
Yep, exactly.
Yeah,
Exactly.
that's great. And so you have a private practice. I've got your website here, um, restfulsleepmd.com, and then Facebook and Instagram. And actually, I'm going to repost this link because I don't think it has the H at the front of it. So it's probably not an active link. There you go. So I think I do want for everybody to know where to find Dr. Funke, because she has such great resources. And we're going to be able to get tips for better sleep on your Facebook and Instagram, I believe, also.
Absolutely.
Yeah, that's great. I think what I have a couple maybe other things to kind of finish up with like my own questions. What do you think about napping? Are you a fan?
I love napping, honestly.
Yeah.
I think it's what do they say? Like it all ends up being why? Why do you need a nap?
Mm,
Right?
okay.
Now, if you're someone who has trouble sleeping at night, you're not able to sleep at night because you have insomnia, then you
Mhm.
probably don't want to sleep during the day, because what that will do is going to steal from your night sleep. It's going to drop your sleep
Yes.
pressure, and then you're not going to be able to sleep at night, right? But if you're someone who's sleep deprived, you're a mom. So my moms that I work with, they're
Hmm.
exhausted. So
Yes.
sometimes that 30-minute nap during the day is the self-care they need. And
Hmm.
so I think at the end of the day, it all depends on what the goal is. If you're already struggling with sleep, and you're not able to fall asleep at night, but you're sleeping during the day, then that might actually be why you're having
That might
trouble
not be a
sleeping.
helpful nap.
Exactly, exactly. I mean, it'll feel good at the moment, but
Yeah.
really, and then the thing about it is, whatever the case, if you're taking a nap, you want to avoid taking a very long nap. So you want to keep it short,
Hmm.
because I'm sure you've experienced the way you've taken a very long nap during the day and you feel crappy, you feel worse.
Hmm.
It's
Hmm.
what we call sleep inertia. So you've really hit some very deep sleep stages, which then
Yeah.
makes you feel more tired. So if you're going to take a nap, I usually will say 20 minutes or so, and you want to do it earlier in the day, not too late in the day.
Okay. 20 minutes or so early in the day, not too
Mhm.
late in the day. What's too late? After 3, after 4?
Honestly, I usually say,
Depends.
you should probably not be napping after about 3 p.m. latest.
Okay.
Yeah, absolutely. Yeah. In fact, sometimes I'll say earlier. So
Yeah.
if you go to bed late, then the idea is you want to be awake enough to build a sleep drive. Right?
Hmm.
Think about it. If you have dinner, you shouldn't be snacking, right? If you're gonna
Yeah.
snack, you want to snack earlier, otherwise you won't enjoy your dinner.
Yeah.
So for me, usually I would say by 1 to 2 p.m. If you're going to take a nap, take it before then. After
Mhm.
that, you're pushing it a little bit.
Okay. Yeah, I like that.
Mhm.
I think that makes some sense, because that late day nap can be sticky to get up from and feel good for the rest of that day, I think.
Exactly.
Mhm.
Exactly.
Very good. Yeah, I think that's super interesting. Yeah, I had a patient recently that actually went to a sleep consultation. I would share this also. She ended up being diagnosed with like an anticipatory sleep disorder, where she was
Mm.
like going to bed at 3 in the afternoon and then not getting up until 10 or 11 p.m., and then she couldn't sleep. And the whole idea was like she needed to stay up later to
Mhm.
try to sync herself back up with the clock.
Yes. And sometimes you do have people who have this really, really delayed sleep phase syndrome,
Okay.
which is just a real shift in their clocks.
Hmm.
And yes, we do that. We call it chronotherapy, meaning that we're shifting, almost like we're gradually shifting your body clock.
Yeah.
It can be challenging depending on how long you've been in that sort of loop, but
Yes.
it's definitely something that we can work on and address.
Yeah. Yeah. And I know she's made some progress, and now she's more like, well, I can get to bed at 7 and I wake up at 4, and that's more like a farmer's hours or
Yeah.
something. She
Yeah.
can,
Yeah.
go to bed super early and be awake super early.
Hmm.
Yeah.
Hmm.
That's so interesting. Well, thank you. Do you have any other pearls, any other words of wisdom to leave us with here, Funky?
Yeah, absolutely. So I always do, right? I love this
Yeah,
stuff.
that's why I asked.
So I think the key is really no matter where you are on your sleep journey, like you
Mhm.
can do better. Don't feel overwhelmed. We've talked about a lot of things today, and you may feel like, oh my gosh, where do I start? Naps, schedule, medicine, where do I start?
Yes.
I would say just pick one thing, even if all you want to pick is I want to now be consistent with my bedtime. So maybe I've had a bedtime that's just been so variable.
Mhm.
Now I'm going to just say at a certain time, I'm going to turn off all the devices and get into bed. That's all I'm going to do. And that is life changing in terms of improving your sleep. That's all. And then from there, you keep building. And
Yeah.
if you go onto my website, I have a worksheet or I would say a checklist pretty much that
Mhm.
goes through some basic places to start in improving your sleep habits. So start with one, just one. Don't go crazy. And then you continue to work on the others. And you'll see things improve over time. And if they don't, you can reach out for help.
Oh, thank you so much. Yes, well, let's all check out restfulsleepmd.com for that checklist and find one thing to work on. I'm gonna have to download it myself. Make sure I have some good checklist points to speak on with my patients.
Absolutely.
Yeah, thank you, Dr. Funke, for being here. I really appreciate it. It is lovely to see you, and this is just such a hot topic. I'm sure that there'll be more to talk about sometime in the future.
Absolutely. Thank you so much
Okay.
for having me. This was fun.
All right. Thanks. We'll be signing off. Sarah Merritt with Lifestream Health Center, Dr. Funke from Restful Sleep MD. Come see us at Lifestream Health in Bowie, Maryland. Pain management that's caring and accessible, patient centric, evidence based. We want to see you. Call us at 301 860 0305. Thank you.
All right. Bye.